Today, I want to explain one important detail about the ACL that many patients never hear about. The ACL is not just one simple rope inside the knee. The ACL, or anterior cruciate ligament, is made of two main functional parts. We call them AM bundle and PL bundle. AM means anteromedial bundle. PL means posterolateral bundle. These names sound technical, but the idea is simple. The ACL has different fibers that work together to control knee stability in different positions. The AM bundle is more important when the knee is bent, while the PL bundle is more important when the knee is closer to the straight position. Together, they help stop the shin bone from sliding too far forward, and they also help control rotation of the knee. This is why ACL is so important in sports like football, basketball, tennis, skiing, padel, or any activity with twisting, cutting, landing, or sudden change of direction. Now, why does this matter for patients? Because an ACL injury is not always the same in every person. Some patients have a complete ACL tear, where the ligament is fully torn and the knee becomes clearly unstable. Other patients may have a partial ACL tear, where one part of ACL is injured more than the other. For example, sometimes the AM bundle may be damaged while some PL fibers are still working. Or the opposite can happen too. This is one reason why two patients with ACL tear on MRI may feel completely different. One patient may say, "My knee gives way every time I turn," while another patient may say, "I have a pain and swelling, but I can still walk normally." That's why we should not treat the MRI alone. We must treat the patient, examination, the stability of the knee, activity level, and the full injury pattern. The AM bundle and PL bundle concept also help us understand why the knee can feel unstable in different ways. If the ACL is not working well, the knee may feel unsafe during pivoting, changing directions, or landing from a jump. Some patients may feel fine when walking in a straight line, but the knee gives way when they try to return to sport. This happens because walking straight does not challenge the ACL as much as rotations and cutting movements. For athletes, this rotational control is very important. A knee may look acceptable during daily activity, but still fail during football, basketball, tennis, or skiing. During clinical examination, we check this carefully. Tests like Lachman test help assess forward stability of the knee. The pivot shift test helps assessing rotational stability. This test gives information that the MRI alone cannot fully explain. MRI is very useful, but the physical examination is still extremely important. Now, let's talk about the ACL reconstruction. When the ACL is completely torn and the knee is unstable, some patients may need ACL reconstruction. The goal of ACL reconstruction is not just to place the graft inside the knee. The goal is to restore functional stability as close as possible to the natural ACL. This means controlling forward movement and rotation. Modern ACL surgery tries to respect the anatomy of the original ACL attachment sites. This is why surgeons pay close attention to tunnel position, graft placement, graft tension, and the overall stability of the knee. In some cases, especially high-demand athletes or patients with a strong rotational instability, the surgeon may also consider additional procedure to improve rotational control. But this decision must be individualized. Not every ACL injury needs the same treatment. Not every partial tear needs surgery. Not every complete tear is treated the same way. The decision depends on many factors: your age, sport level, instability symptoms, additional meniscus injury, cartilage condition, knee alignment, your goals, and at the end, your lifestyle. The meniscus is especially important. Many ACL injury happens together with the meniscus tears. If the meniscus is also damaged, the knee may become even more unstable, and the long-term risk to the cartilage can increase. This is why early and accurate assessment after a sports knee injury is important. So, what should patients remember? The ACL has two main functional bundles, the AM bundle and the PL bundle. The AM bundle helps more when the knee is bent. The PL bundle helps more when the knee is closer to straight position. Together, they control forward movement and rotation of the knee. This is why an ACL tear can cause instability, giving way, swelling, pain, and difficulty returning to sport. And the most importantly, ACL treatment should never be based only on one MRI sentence. A proper diagnosis needs your injury story, your symptoms, your clinical exam, MRI findings, and your personal activity goals. If you twisted your knee, felt a pop, developed swelling, or your knee feels unstable during sport, get it properly assessed by a knee specialist. The earlier we understand the full injury pattern, the better we can plan the right treatment and protect the future of your knee. This video is for the education only and does not replace a personal medical consultation.